Hey future nurses, Dr. Mike here, and let's talk about something you'll see a lot in your careers: musculoskeletal disorders. These conditions affect your patient's ability to move, and knowing how to care for them is crucial for acing your NCLEX and being a great nurse. The NCLEX exam tests your knowledge on a wide range of medical topics, including musculoskeletal disorders. These disorders can affect bones, joints, muscles, and connective tissues, leading to pain, inflammation, and impaired mobility. Understanding the pathophysiology, signs and symptoms, and nursing interventions for common musculoskeletal conditions is essential for providing safe and effective care. Whether it's osteoarthritis, rheumatoid arthritis, fractures, or other related conditions, you need to be prepared to answer questions about these disorders on your NCLEX. We'll break down these complex topics into easy-to-understand concepts. We'll cover the most common conditions, their causes, symptoms, and how nurses play a vital role in treatment and patient education. Remember, your goal is not just to pass the NCLEX, but to become a competent and confident healthcare professional. By mastering your understanding of musculoskeletal disorders, you'll be well equipped to care for your patients and excel in your nursing career. Let's dive in. One of the most common musculoskeletal disorders you'll encounter is osteoarthritis. This condition is a degenerative joint disease, meaning it causes the cartilage in your joints to break down over time. Cartilage is that slippery tissue that allows your bones to move smoothly against each other. When cartilage wears down, bones rub together, causing pain, stiffness, and inflammation. Osteoarthritis typically affects weight-bearing joints like your knees, hips, and spine. Think about it. These joints bear the brunt of your body weight every day, making them more susceptible to wear and tear. Symptoms of osteoarthritis often develop gradually and worsen over time. You might see your patients experiencing pain that's worse after activity or in the evening, stiffness in the joint, especially in the morning, a limited range of motion, and even a crackling or grating sensation when they move the joint. As a nurse, you'll play a key role in managing osteoarthritis. Treatment focuses on relieving pain, improving joint function, and slowing the progression of the disease. This might include medications like pain relievers and anti-inflammatories, physical therapy to strengthen muscles and improve flexibility, and lifestyle modifications like weight loss and exercise. Now let's shift gears to another common type of arthritis: rheumatoid arthritis. Unlike osteoarthritis, which is caused by wear and tear, rheumatoid arthritis is an autoimmune disorder. This means that your body's immune system mistakenly attacks its own healthy tissues, in this case, the lining of your joints. This attack leads to inflammation, pain, stiffness, and eventually, joint damage. Rheumatoid arthritis can affect any joint in the body, but it commonly targets the small joints in your hands, wrists, and feet. It often affects joints symmetrically, meaning if one wrist is affected, the other one likely is too. The symptoms of rheumatoid arthritis can be quite varied and often come and go in flares. Patients may experience joint pain, swelling, stiffness, fatigue, and even fever. Early diagnosis and treatment are essential to slow down the progression of joint damage and manage symptoms. Treatment for rheumatoid arthritis typically involves a combination of medications and lifestyle changes. Disease-modifying anti-rheumatic drugs, DMARDs, are often prescribed to suppress the immune system and slow down the progression of the disease. In addition to medications, your role as a nurse will involve educating your patients about managing their condition. Section 4. Total hip replacement, navigating postoperative care. Total hip replacement replaces a damaged hip joint with an artificial one. Nurses monitor vital signs, manage pain, and help regain mobility. Early mobilization prevents complications and promotes healing. Teach patients to avoid bending past 90 degrees and crossing legs. Section 5. Scoliosis, understanding spinal curvature. Now let's discuss a condition that affects the spine: scoliosis. Scoliosis is a sideways curvature of the spine that often develops during the growth spurt just before puberty. While the exact cause of most cases of scoliosis is unknown, it can be associated with conditions like cerebral palsy and muscular dystrophy. Scoliosis can range from mild to severe. Mild cases may not cause any noticeable symptoms, while severe scoliosis can cause back pain, difficulty breathing, and even affect heart and lung function. Early detection and treatment are crucial to prevent the curve from worsening. Treatment for scoliosis depends on the severity of the curve and the patient's age. Mild cases may only require regular monitoring, while moderate to severe scoliosis may necessitate bracing or even surgery. Bracing helps slow down the progression of the curve, especially during growth spurts. Surgery, typically spinal fusion, is reserved for severe cases where bracing is no longer effective or when the curve is causing significant problems. As a nurse, you'll play a vital role in educating patients and their families about scoliosis, its treatment options, and the importance of adherence to treatment plans. Section 6. Fractures, types, care, and potential complications. Fractures are breaks in bones caused by falls, sports injuries, or accidents. They range from simple cracks to complex breaks. Symptoms include pain, swelling, and deformity. Immediate care involves immobilization and medical attention. Treatment varies from casting to surgery. Watch for complications like compartment syndrome. Section 7. Gout and herniated disc. Exploring other common disorders. In addition to the conditions we've already discussed, you'll also encounter other musculoskeletal disorders in your nursing practice. Let's briefly touch on two more: gout and herniated disc. Gout is a type of arthritis caused by the buildup of uric acid crystals in a joint, leading to sudden, severe attacks of pain, swelling, redness, and tenderness. Herniated disc, on the other hand, occurs when the soft, jelly-like center of an intervertebral disc pushes through its tough outer layer, irritating nearby nerves and causing pain, numbness, or weakness. Both of these conditions require prompt diagnosis and treatment to manage symptoms and prevent complications. Understanding the pathophysiology, symptoms, and treatment options for these conditions is crucial for providing effective nursing care. Remember to use reliable resources like textbooks, medical journals, and reputable online sources to deepen your knowledge and prepare for your NCLEX. And don't forget to practice applying your knowledge with NCLEX practice questions to test your understanding and build your confidence.